We're leaning in on the expertise of our internal team, the feedback that they're getting from customers.
Hello and welcome to the Healthtech Marketing Podcast, brought to you by Health Launchpad and HIMSS. Hi, I'm Adam Turinas, Health Launchpad founder and CEO, and your host today. I want to give a big thank you to my partner HIMSS, without whom this wouldn't be possible, and also a big thank you to you for joining us today. Today I'm delighted to introduce our guests, Lizzy Feliciano and Elizabeth Fennell from H1. Lizzy is the SVP of Marketing and Elizabeth is the Director of Integrated Marketing. So welcome to you both to the show. I'm so delighted to have you both here. First, tell us a little bit about yourselves and your journey, how you came to H1. Why don't we start with you, Lizzy?
Sure, absolutely. So thanks for having us here. We're delighted to share today. So I have been leading marketing, sales, and go-to-market strategy in the healthcare technology and data space for coming up on 30 years, which is pretty unbelievable. I've had the privilege of working for some amazing startup companies as well as global organizations like LexisNexis, and really just have always been passionate around taking products to market, helping create visibility and differentiation in the marketplace and connecting with the buyers, right? The stakeholders that benefit the most. And it was probably about a year ago, if not a little longer, that I happened to meet Ariel Katz, our CEO and founder, and he was just sharing a little bit about what H1 was doing and where they were going, and super passionate person, very mission-driven organization. And so we kept in touch. And shortly after they closed their significant raise last year, he said, you know what, we're ready to double down on marketing and really build a world-class marketing organization. So it was kind of perfect timing for me. And I decided to make the leap. And I've been here officially since January of this year and really excited about what we're doing.
That's so exciting. That really is. And Elizabeth, how about you?
I have a little bit of a different journey. I started out in content for research hospitals. So I've been in healthcare, marketing, PR, storytelling for 25 years, and found my way to marketing through LexisNexis working with Lizzy. But my background really had been the patient journey and storytelling. And so when Meaningful Use came about, started working at McKesson, and then really the technology piece of health IT kind of married with everything that I had been doing. And it was just seemed like a natural fit. And then found my way to H1 because Lizzy and I had a great collaboration and partnership. And I'm super excited for H1's mission and to be working with her again.
Thank you. So I'm curious, what does H1 do and where's that name come from?
That's a common question. We get that a lot. So H1 is very well known in the realm of research, and it has to do with testing out hypotheses. So when you're looking to prove a hypothesis true, H1 is sort of the industry term, if you will, that is used. And so, they selected it as the name of the company because they were setting out to prove true their belief that ties into what they do, which is that a truly healthy future for people around the world is dependent on having access to as much information about doctors and healthcare professionals that are delivering care as possible. And so at the heart of what H1 does, we are that single source of truth. We convene information for healthcare professionals around the world globally, and make it accessible not only to our customers across the life sciences and biotech industries. We're working with healthcare payers. And the mission here is really to create a healthier future by making this information accessible. We want to be the place where everyone can go to understand, is this the right doctor to treat my condition? Is it the best doctor to treat my condition? Is this doctor seeing new patients? If I'm trying to bring a drug to market, is this the doctor with the right profile, the right diversity in their patient population for the drug that I'm trying to deliver? Is this doctor, does he have or she have a strong sphere of influence so that they can allow us to amplify the work that we're doing with groundbreaking medicine and research? We're also passionate about creating a community where healthcare professionals, researchers, and scientists can come together and share the work that they're doing. We recently acquired a company called Faculty Opinions based out of London. And that really is a community of experts from the medicine, the biology industries, and they're opining and sharing research and commenting on research to help organizations and other stakeholders make critical decisions. And so that's what we are. We are really just a convening force for everything that you want to know about every doctor around the world, updated on a daily basis.
So how is that how is that different from something like health grades or maybe doximity or something like that?
Yeah, absolutely. So there's a few different ways that we're different. And I think the first one is something like health grades. You're usually looking at a doctor's performance based on a patient experience, not based on factual outcomes that are being realized by those patients. And so we are looking at all sorts of information points to understand the quality of the care that these physicians are realizing across their patient population, fact-based, versus just those experiential elements and factors. In terms of doximity, we have a broad network of physicians that are able to come in and share their work, comment, claim their profiles, make sure that we are up to date on their scholarly and their clinical work. But we're also bringing in global data sources that are helping to bolster those profiles on a daily basis. And so the sheer breadth and depth and frequency with which we're able to maintain and grow those profiles is pretty significant. And I also think that one of the things that we're moving towards is really looking at AI-enabled doctor interactions. So how can we apply advanced technology like AI and machine learning to surface things that are really meaningful and can make an impact in the daily work that our stakeholders are engaging in? So whether it's an MSL, a medical science liaison, who is trying to, strategize for their territory, identify who the up and coming rising stars are within a therapeutic area, or who are the digital influencers, right? The world has changed. And so it's just as important to understand who those traditional key opinion leaders are across the HCP universe, who they are, but almost more importantly is who are the folks that are coming up, right? That may be sort of those hidden gems that are just starting to get published, are just starting to create their sphere of influence, but they're super active on digital channels, so they have a broader reach. So we're really focused on sort of elevating those more nuanced areas within an HCP's universe.
It's really fascinating. And just so briefly, how does the company make money? Who are the customers? What's the revenue model?
Absolutely. So we are a SaaS-based business. We have one, we call it the H1 Connect platform, which is sort of the universe of data and analytics that we bring together. And then we have several products that address the needs of specific stakeholders across life sciences. So we are working with, the top pharma companies in the world. We have medical device companies, biotech payers, commercial payers, next-gen payers. And our solutions can sort of provide each one of those stakeholders, whether it's medical affairs or it's clinical operations. We can provide those audiences with the most relevant view of the healthcare professionals within our H1 Connect platform to inform their strategy at the corporate level, as well as help their, their teams on the ground engage. And so it's a SaaS licensing agreement. We're really excited to be working across the industry.
I can see how there's so many use cases for this. So you guys have raised a considerable amount of money. It helps that you have a CEO who's a proven entrepreneur. What's the ambition of the company? Where are you going?
So as I mentioned earlier, very mission-driven company. And everything that we are looking to do and accomplish is all with the intent of creating this healthier future by bringing information together and then more importantly, making it accessible. So we want patients in any corner of the world to be able to understand, find, and engage with the right doctors. And so what that means for us is that we're going to continue to double down on making sure that we have as much information as possible, that we're building out the right analytic infrastructure to surface insights more quickly, more rapidly, so that drugs can get to market faster, making sure that we can inform decisions that lead to a more equitable healthcare system. So we focus a lot in the clinical trial space on bringing to light, right, diversity and inclusion and diversity and equity data that can make sure that our clinical trials are representative of the patient populations that they're meant or that are most impacted by certain conditions. And so as long as we can continue to build both our platform, our data, and our analytics to serve that purpose, that's where we intend on.
Yeah. What I think is so impressive is that you've got, a big audacious ambition. There's real specificity on what the value of what you're doing is. Seems to be different. I haven't heard of other companies doing that. But clearly, once you've got the data and the analytics, that can lead into all sorts of other things. I can imagine how, it's going to give you a flexibility to adapt to, all sorts of other opportunities. It's terribly exciting. Absolutely. So let's switch gears and talk about marketing in particular. So you talked about building a world-class marketing organization. Where does marketing fit in to what H1's doing? What's your approach?
Absolutely. We're really excited about building up this team and, 6 months in and we've seen amazing results, and it's really about taking an integrated approach. So I think oftentimes organizations that have not experienced the power of marketing for a long period of time can tend to just maybe want to invest in one particular area. And one thing that we are doing is making sure that we are sort of working with a broad marketing mix to where we can reach our audiences where they are. And because we are global, right, that becomes that much more complex. Marketing overseas, the regulations that we have to comply with, right, all kind of weigh in. And so for us right now, we're just building a really good marketing mix, measuring how accurately we are in finding those channels where our customers and our stakeholders are, where they're digesting information, making sure that we're using thought leadership and media and PR as a vehicle to tell our story. And Elizabeth, she leads our integrated marketing, so I'm sure she has plenty to share as well.
Yeah, thanks, Lizzy. I think when you think about marketing and having come from the startup world, it's all about revenue, right? And bringing in leads, and they want to see that revenue quickly. But when you think about how long it takes to build a brand from the ground up, you're looking at 2 to 3 years, and that's going to take time to educate the market on the challenges, to find your buyers. And I think sometimes in marketing, it's just as important to look at what doesn't work as to what works. I think you have to be metric driven. And I kind of have 3 things that I think are most important. One is research first. You can't understand your audience without talking to them. All good marketing should be founded on metrics and data around the audience engagement, the reach, their pain points. What news are they consuming? What news is affecting them? We had some of our clients be affected by the FDA's new guidance on diversity and inclusion in clinical trials. So how are we speaking to those pain points? And then all that's fit to print. You have to read what your audience is reading, consume their media. And sometimes it doesn't work, and that's intelligence, just retroactively looking at data to support your story. And at the end of the day, what we do is complex, but it's about people. And building a healthier future, healthcare is about people, making it more accessible and equitable. And this is really a story that everybody can get behind. I mean, we tell our story through our mission. And so when I think about our content and all of the things that we're doing, I think, how would this affect me or my mother or my children? So start with your mission, and that tends to resonate with people.
Absolutely.
Very interesting. I just want to go back to your first point, which is about putting the customer at the center of it and starting with customer insight. You know, it's a sort of kind of personal mission of mine to make sure that happens. And it's I always find it, you know, in the healthcare, health tech space in particular, sometimes that's either, you know, doesn't happen or happens in a very superficial way. How do you guys go about doing that? How do you bring the customer into the process?
My experience is really partnering with those trade organizations, those professional organizations, for example, HIMSS, or for us, it's MAPS or MSLS, really where those users go to for education and information. They have the reach. So partner with them and leverage those partnerships to be able to glean research, even if it's performing a webinar with polling questions. That's intel. If you're asking about their challenges or things that they're experiencing, you know, there's so many places you can pull that information out. And I know research can tend to be an expensive tactic for companies that maybe, you know, don't have the budget for a $60,000 research project. There's a lot of different ways you could do that.
And I'll just add to that. Equally important is as marketers partnering within your organization with the customer success teams, with the individuals who are on the front lines with the customers day in and day out, supporting the work that they're doing. I think we here at H1 have an amazing team, you know, 50 plus individuals that are just engaging on a daily basis with customers. And so we're able to create that closed loop, understanding where customers are seeing value, what their new pain points are, because that changes, right? And depending on the size of the organization, the needs are different. And so just having that line of communication and collaboration internally is also a really important point to making sure that the customer is at the center of everything that marketing is doing. I
see. Yeah. I want to talk a bit about product marketing, because you've got if I interpret it correctly, you've got a kind of a platform offering in what you're doing, but there are different use cases for different constituencies, different target, different segments within the market. How do you tailor the way that you message, or even tailor the product for different audiences?
Yeah. I mean, that's always right. That's always the golden ticket, is how do you do that? And more importantly, do it effectively. I think that we've created an internal source of experts here. We have an amazing team leading our product and technology and data orgs. We have a solution organization of individuals who worked in the same space as our customers. They come from pharma companies. And so we already are starting in, I think, a much stronger place than a lot of organizations can say, right? We've got that internal subject matter expertise. And so from concept to commercialization, we're leaning in on the expertise of our internal team, the feedback that they're getting from customers. We're looking at, through our relationship with those industry partners that Elizabeth mentioned, we're getting a really good feel, and this is daily, on where the market is going. And we're taking a look back at our products and we're saying, does this product not only meet the needs of today, but are we set up to meet what's coming down the pipe in the next 12 months? And running a really tight go-to-market process, right? I'm a fan of pragmatic. I know a lot of people say that's antiquated, but I am super into organization and structure.
Explain what pragmatic means. Yeah.
So pragmatic is just a go-to-market framework that allows you to streamline everything from, roles and responsibilities across your organization. Who owns the concept? Who owns decisioning around, do we build or do we buy? Yeah. All the way down to what does sales enablement need to look like to commercialize effectively? So it just provides a really good sort of reference point for the org and all of the various functions to rally around. And it allows you to create a repetitive process so that you're more efficient in getting products from creation out to the market. And so, our team we have regular calls. We're working with customers. We're looking at roadmap consistently. We're, accelerating. It's a very agile sort of process internally that they run on the product side. And so, that voice of the customer is where we start. And then that pragmatic framework is what allows us to make sure that the enablement is ready and available for the commercial teams.
It's interesting. Sorry, carry on, Elizabeth.
All right. I was just going to say, and I think for product marketing, it's really important that you look beyond just feature function updates, because if you're not empowering your sales team to really understand how your new product features are fitting into the broader storytelling, then they're not going to be able to explain that to the customer. So I think, as you do those rollouts, it's just as important to understand what the story is you're building around how those features and functions will impact your mission and industry.
I see. I think what's impressive about what you're doing and how you're going about it is that, 50 people, it's still a small, fairly small company. It's a nice size actually, but it sounds like you're kind of balancing the discipline of a large company that's scaling up, that sort of the vision of where you're going, but you're still nimble and acting sort of, using the advantage of being small, which is being nimble.
Well, interestingly, we have more than 500 employees.
Oh, okay. I don't know where the 50 came from. Okay, that's pretty big.
Your statement is still true, right? We had rapid growth. And so I think what the good news is that we all understand that creating those processes early on are really important so that we can continue to scale.
Yeah, absolutely. Yeah. ABM, is that something that do you guys ABM?
ABM, that's the marketing buzzword. There's always a new buzzword in marketing, and it's, account-based marketing. So the answer is yes. ABM is really dependent on data, both the data that you have, the data that you're able to capture, and then how can you operationalize and act on that data. And so for us right now, we are in the building stages of our sort of ABM journey. We're really just focused on more awareness account-based marketing. So who are those top 30 accounts that we want to, because we're global, get as many eyeballs across those accounts to look at H1, to consider H1. And as we build our marketing tech stack, which is another big part of ABM, we'll be able to start sort of pivoting into more of the personalized ABM journeys, which is really, I believe, where you get the value of ABM.
So, you're not using, a platform like Demandbase or Terminus yet? Not yet.
But we definitely, I've had experience with several platforms. They do a lot of good things. I think the most important piece of any ABM, a successful ABM strategy, is the orchestration component. And so, if I have to say anything or give advice to anyone looking at ABM, is just make sure that orchestration piece is not missed, because at the end of the day, that is what ultimately will make sure that you're able to get the results you want.
Can you expand on that a bit? Because I think orchestration is a term that it means a lot of different things to different people, and it's quite specific in ABM.
Yeah, I mean, for us, when I think of orchestration, I really think about being able in real time to capture where the accounts are coming in through, what they're engaging with, and then what supporting outreach have you automated to keep that individual engaged in the right way, and then progress with them. And so there's a lot of planning that goes into that. You have to have a really robust content library ready to go. You have to be really clear on your ICP, your ideal customer profiles, and your personas. If you have that groundwork in place, then orchestrating an ongoing ABM campaign becomes that much more easy. Because again, ABM is not something that you just run for a quarter or 2 quarters. You're there for a journey of, years, if anything. And so it's really important to make sure that you're able to connect the dots across all of the various touch points, and tie that back to relevant messaging for those stakeholders.
Yeah, I think too, in health IT, we our buyer journey tends to be long. Our buying cycle tends to be longer. And so I think that's where the orchestration comes into play even more importantly, because we may have a buying cycle that's a year. So you're looking at a year-long touch points to try to engage that contact.
I so agree with you.
Yeah, if I could just add to that. And that's the importance of also being able to segment your markets, whether it's enterprise or it's SMB mid-market. because those buying cycles are different and vary. And so you're going to want to customize that ABM journey also based on sort of what that buying cycle looks like.
Yeah, I think thank you both of you, because I think it was a very articulate and specific description of it, and you can see why companies are adopting the platforms, the Demand-Based, Sixth Sense, Terminus, all those guys, Triblio, because you just can't do that manually. Particularly, Elizabeth, to your point, over a 12-month, 18-month life cycle, you lose track of people.
Yeah.
So I think that's very helpful. Okay, so we're coming to a close here, and I've got a question that I ask everybody, and that is, if you could go back in time and give yourself one piece of advice, something that you wish you'd known earlier. It could be anything. What do you wish? What would that be, Lizzy? Do you mind going first?
Absolutely. I mean, I think there's two things that always stand out to me. One is, stop doubting yourself. You give yourself more credit for the knowledge that you bring and the experience that you bring to every conversation. I think earlier in anyone's career, there's that hesitation of not wanting to opine, not wanting to insert yourself in certain conversations. And a lot of times we miss the opportunity to not only elevate ourselves, but more importantly, to truly affect, right, whatever it is that the business is trying to accomplish. So that's usually the first thing that I think of. And then the second thing is it's probably take more risks. I think that sometimes in your career, you tend to want to play it safe. And if I could go back, I think there were probably a few opportunities that I had to take some bigger risks, and I missed out on some stuff. So I would definitely say that.
Thank you. Elizabeth, how about you?
I think it would be to slow down. It's not a race to the finish, and you're going to mess up. So stop and learn from your mistakes, and don't forget who you are. Stay authentic, and don't change yourself for a culture of a company or a boss or another person, because I'm not always the loudest person in the room. And I used to be afraid to speak up, but now I've learned that I just wait my turn, or not my turn, but I wait till I feel like I have something important to say, and I say it. I'm not afraid to. So.
Well, that's great. I really appreciate that. And I'm sure the listeners will do too. So, well, it's been a great pleasure to have you both on the podcast. And I want to thank you very much for making the time for us today.
Thank you for having us.
Absolutely.
And before we go, I want to let the listeners know, or the viewers, whether you're watching, whichever way you're consuming this thing, that you can subscribe to this podcast on Apple or Apple Podcasts or Spotify, or a dozen other different podcast apps. You can also view the video through a link in the show notes. Please subscribe. We have a great program of guests coming up. And thank you all to listening. And if you're listening to this and you think you've got a topic that we should cover, you can email me at adam@healthlaunchpad.com.